Well, welcome again to our Start or Sit podcast. This is Shannon O'Kelley. I'm joined with Dr. Hawkins, orthopedic surgeon. We are going to look at some previous weekend injuries here in the NFL, and to the best of our ability, what we know, what we've read, we're going to talk about that player, that injury, and potentially the return to play, and that's why we are calling it Start or Sit. Is the player going to be able to return to start, or are they going to have to sit out for a little while, and how long is that going to be? Dr. Hawkins, how are you?
I'm doing outstanding. Thanks again for having me on.
Yeah, absolutely. I mean, I really enjoy doing this. This is our second time. So, again, with the information that we have and you've read and heard, based on our best professional assessment, we're going to talk about what's going on and what the potential is to return to play. So let's get off to a fast start with one of the top running backs in the league. This is Kareem Hunt, running back for the Cleveland Browns. Sounds like he has a significant calf strain. Let's talk about the calf strain, some concerns around the calf strain, and then regarding getting back on the field. Let's get started here with calf strain, Kareem Hunt. Dr. Hawkins.
Yeah, essentially he went down with a running play. It wasn't a heavy contact situation, and obviously when somebody like that grabs their lower leg, you have to be concerned about the dreaded sort of Achilles rupture, and that's where the tendon is torn at the bottom, and that's a surgical problem. So the way they treated him initially, I think it was a little bit unclear. We have some more information getting into this week. He was able to get an MRI done, and it came back that the tendon itself was not torn. So what we're looking at here is what we oftentimes call a medial gastrocnemius injury. So essentially that's an injury of the muscle tendon junction, and those tend to heal. So he's not in a situation where this is a season-ending injury. However, because of his position and because of what he needs to do to push off, to have power and acceleration, he's definitely going to be sidelined probably 4 to 6 weeks. They did place him, I believe, on injured reserve, which means a minimum of 3 weeks. So he'll probably spend 2 to 3 weeks in a boot. He'll be working on his rehab, and then they'll probably reassess him with starting some light practice activities in that 4th week. So I think 4 weeks is a minimum time he's going to be out. So if you're looking at him from a fantasy standpoint, he's somebody you definitely want to kind of hold on to because he is going to have a role moving forward. He's not going to end his year, but definitely don't put him in your lineup.
Yeah, pretty significant. I mean, when they're worried about the Achilles tendon and they go down like that, you're exactly right. I mean, that's a very good point. It's good that it's not the Achilles tendon. That is surgery. But here we are. We're talking about biology. We really are. There's no really intervention from a surgeon, orthopedic surgeon, sports medicine physician that is going to kind of increase this healing time. We know that physical therapy, some treatment is going to help promote that, but it really is biology. And this takes about 4 to 6 weeks for that muscle tear to kind of re-heal itself. The good point. So he's out at least 4, possibly 6 weeks. Correct?
Correct.
All right, excellent. Antonio Gibson, running back for the Washington football team now. Let's see. This is a tough one because I don't know if you were able to see a lot of information, but just when I saw this, apparently he went into the game. He had been out with a previous stress fracture, and I would imagine this is in his tibia. So let's talk about that, how that happened, how that occurred, how he got re-irritated, and again, a stress fracture. Describe what that is.
Yeah, absolutely. This is a situation where, the devil's in the details. And the fact that they actually played him probably indicates that they didn't give out the correct information in the beginning. If you truly have a stress fracture, which is essentially where the bone is about to break, you've got a line in the bone itself, then that person's pretty much out of commission. So in his situation, there's sort of a spectrum of problems. It starts off as shin splints a lot of times, which is where there's muscle pull on the bone itself, which causes inflammation and irritation. And then that can progress into what I would call more of a stress reaction. And that's a situation where if they get an MRI, they see inflammation in the bone itself, but they don't see a fracture. And that's probably the situation he was in, given that he's a high-level athlete. Like I said, I can't imagine they had him out on a true stress fracture. Now, they did come out with a little bit more information recently, which does indicate now they're starting to talk about it as a bad shin splint. So I think we're starting to find out he's in that middle ground.
Okay.
The problem again is yeah, go ahead.
No, I was just going to say, no, okay. I mean, I want you to explain that middle ground, and you were taken off there. Tell us about that stress fracture and that middle ground you're getting there. I want to hear about how that shin splint kind of results in a stress fracture.
Yeah, essentially think of it like sort of bending a paper clip. When you take a paper clip and you start messing around with it a little bit, you're moving it back and forth, and then it starts to heat up a little bit right before it actually breaks. So he's in that position where that bone is heating up a little bit. It's taking stress because of the muscle pull, and then he's aggravating it by running on it as well. And guys like him that have very strong muscles, that puts a lot of tension on the bone itself, essentially causes like a bending moment on the bone. And so that's where he is. And usually those things, you rest them, you feel better, but then you get out and you play a little bit and it starts hurting right away. So he's going to be hard to predict how much he's going to be able to keep going. He probably wants to play through it, but if his productivity goes down, then I think they'll pull him out of games.
In your experience with this stress fracture or this heated up bone, as you described it, that's an excellent description, the paperclip. I love that. Are these athletes, are they perceiving pain when they stop, start, cut? Because that muscle's pulling on that hot bone. It's got to hurt, and it's got to impede their functional capabilities, I would imagine.
Yeah, exactly. When it's bad, it hurts just to walk. It's like, essentially stepping on the hot coal each time. But especially if you're going to push off, with your lower body, those muscles that we're talking about are the ones that allow you to push off at the ankle level. So a running back's going to use those every time he cuts, every time he tries to accelerate, and every time he tries to run into another 250-pound guy.
Yeah, it's interesting from an anatomical standpoint. I know we're on the radio, but I want our listeners to understand the structures, the connective tissue, and the muscles between those two bones, that tibia and the fibula, and how those bones are kind of mobile when you're active, and the irritation, the pull, just the stress on that bone that creates that tibialis stress syndrome. Great information. Thank you. He is definitely going to be out, what would you say, at least, come on, how many weeks here?
Well, at this point, again, he seems to think he's going to try to play, but I think his productivity, you're going to talk about, he should be shut down for probably 4 weeks. I think he might limp into a couple of games, but I don't think he's going to be a meaningful contributor. So if people are paying attention to whether they're going to get much out of him, I don't think he will be productive if he tries to play.
Probably assume you'll know in or out, sit or start or sit in 2 weeks, and most likely you'll hear more.
Correct.
Okay, Kadarius Tooney, wide receiver, New York Giants. Again, the old ankle injury. Again, what I'm seeing here, he just went out in the first quarter of the game. I can't remember. I think he might have even re-aggravated a previous injury. That's why I want to talk about it, is because this is one of those players that probably rehabbed, felt better, and then went out and re-injured it. And there's some susceptibility here when you come off an injury and go back to play. So let's talk about that.
Yeah, his situation sounded like he had sort of a typical ankle sprain. We've touched in the past a little bit about like sort of low versus high ankle sprain. So we're assuming he had a low ankle sprain, which is those ligaments or ropes that are just at the level of the ankle itself, but not up into the lower leg. He went out quick. A wide receiver comes down on a foot and puts a lot of stress on it. So the concern is was this a progressive injury becoming more of a high ankle sprain? The good news is they were pretty clear in the last day or so that he's not going on injured reserve. So I think we're looking at just something where he tweaked it, probably had some pain, and they said, listen, let's not make this worse. And so they pulled him out. So he's not going to be in this week. He's a sit definitely for this week. But I think he's going to be back being productive in the next 2 to 3 weeks. Yeah,
let me ask you a question as in your experience, because I know in mine, these ligaments, I just want to kind of talk about anatomy here a little bit. You described them, I think, in our past conversation as ropes. They're very fibrotic pieces of tissue that connect bone to bone. Super important for the stability of the ankle. When that ligament is torn, heals, and then is re-torn again, I mean, it just kind of it puts you backwards in that healing process. Again, we're talking about biology. So he is out for this week for sure. And do you think I know it would kind of crystal ball here, but because it's a re-injury, is there any challenges for him to get back quicker just because it's a re-injury?
Yeah, I think what they're probably going to do, they're probably simply going to look at improving his strength, making sure his flexibility is within his normal size, and then probably try to figure out what type of external support they can get on him to get him back. I think that'll be his goal to try to return. I think they'll he's a very talented guy, and unfortunately that offense needs him.
Yeah, right.
I think they'll. Yeah, he's going to have a lot of options. So
okay.
I think they'll get him back.
Yeah, I do too. So 1 to 2 weeks there, folks out there, if you're thinking about start or sit. Okay, our last player here, Parris Campbell, Indianapolis Colts. I mean, this is kind of all I know is I read he had a significant foot injury. And anytime I hear of a football player having a significant foot injury, there's a couple things that come to mind. The foot, so important. This guy is a wide receiver. He's stopping, starting, jumping, twisting, and turning, and landing on those feet. What do you think?
I think this was definitely a Lisfranc sprain.
That's what I was.
When you were intimating things we hear about. Yeah, his foot was caught underneath him. It was plantar flexed, meaning it was pushed all the way down when he came down. He had another player on top of him. So that injury is an injury to the midfoot. It's an injury to the ligaments that actually support the arch of the foot itself. And so those can be really devastating injuries. When they're bad, they always need surgery, but they've learned how to rehab these sprains, but they need to be completely shut down. So he's done. He's not going to be back this year.
Yeah, I agree. I mean, when you look at anytime you see a significant, in quotations, foot injury, as it was in the press, that is a Lisfranc. And a Lisfranc is one of those injuries that, like you said, you're exactly right. You got to do surgery. A lot of times you'll put a screw in there to stabilize that arch, and then it just takes time. It just has to heal. And will you guys ever go in and put like a ligament, like a graft in there if that ligament of that midfoot is torn so much that you actually have to regraft it?
Sometimes, but the problem a lot of times is that that's not going to necessarily hold up to the stress you have. So the idea behind the screw is you kind of fuse it, and because those bones don't move a whole lot, and so you just accept that. The downside is that leads to stress around it. So it oftentimes will shorten somebody's career if they need to have the screw put in. They'll be back, but they'll have some other arthritic issues around it sooner than they would otherwise.
I feel bad for this guy, 24-year-old wide receiver, probably done for the season of 21-22 for sure, if it is a Lisfranc. Dr. Hawkins, again, this has been a pleasure. This was so fun. We're already out of time. I can't wait to talk to you next week. And just for our listeners out there, we're not sitting around going, we hope we have some great injuries. That's not what we want. We want to be able to communicate, educate, and talk about those players that are injured in this wonderful game that we all love, which is called football.